State may call their first witness.
Thank you, Your Honor. State of Ohio will call Darien Lyles.
Urine Analysis. Please raise your right hand for me, please. You solemnly swear the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God. Ma'am, please have a seat. Now, ma'am, there is media here in the courtroom today. Do you have any objection if your image is filmed or photographed during your testimony? All right. You state your full name for the court reporter, please.
Urine Analysis.
Mr. Tiemann, you may inquire.
Ma'am, would you still spell your first name for the court reporter?
D-A-R-I-E-N-N-E.
D-A-R-I-E-N-N-E?
Yeah.
Okay. And your last name Lyles, L-I-L-E-S?
Yes.
All right.
You need to speak up. Talk to him like he's clear across the room.
Okay.
Which I pretty much am. Where are you from, ma'am?
Lucasville, Ohio.
Okay. And what's your educational background?
I have an associate's degree in nursing from Shawnee State and a bachelor's from Ohio University.
And what kind of licensure as a nurse does that give you?
A registered nurse.
All right. Are you employed?
Yes.
What's your employment history?
I've worked at Southern Ohio Medical Center for 3 years, a year in the emergency department and 2 years in maternity.
Southern Ohio Medical Center, what is that?
The medical center here in town, the hospital here in town.
Is that a full-service hospital?
Yes.
And you'd indicated you'd worked there for 3 years?
Yes.
Where are you currently stationed?
Maternity.
Okay. And where were you stationed in January of 2019?
Maternity.
Okay. What are your duties in maternity?
We provide care to the laboring patient. We evaluate the status from the time of arrival to delivery, assist in care after delivery with initiation of breastfeeding and postpartum care, things like that.
Have you ever heard the term triage?
Yes.
What does that refer to?
Triage is where we evaluate patients on a basis of need. We determine if they are in labor, if they need NSTs. We evaluate the mother, the baby, and their well-being.
Okay. And I know you think you're speaking loud, but if you can speak a little more loudly so we can hear, okay? Ma'am, I'd like to direct your attention to January 10th of 2019. Were you working that day?
Yes, I was.
Do you recall what hours you were working?
I would work 7 p.m. to 7 a.m.
All right. So that being January 10th, are you talking about on January 9th you would have worked to 7 p.m.?
Yes, I would have came in on the evening of the 9th.
And then then you would have been relieved of duty on 7 a.m. the morning of the 10th?
Yeah, about 7:30 in the morning.
Okay. And where were you working that morning?
I was in triage that morning.
Okay. Where is triage located at the hospital?
It is at the entrance of the double doors of maternity, the first door on the left.
Okay. Were there other nurses or employees working with you in maternity that day?
Yes, that night there were a few of us in triage. There was me and Amanda Jones.
Okay. What was that evening like at maternity? Was it busy? Was it steady?
It was slow. It was a slow evening.
What about that morning of January 10th? How was it then?
Slow until this delivery. Then it became somewhat hectic.
Okay. Do you recall on that morning individuals by the names of Groves coming in to maternity?
Yes, I do.
All right. And approximately when did they come in?
5:25 in the morning.
And do you recall their names without looking at your medical records?
Yes, Jessica Groves and Daniel Groves.
And are they in the courtroom here today?
Yes.
If you could point them out for the judge.
Right over there.
Okay.
She's pointed to and identified the defendants in this matter.
Thank you, Your Honor. To your knowledge, why were the Groves in the hospital that day?
Jessica believed she was in labor.
What is the typical procedure or protocol you follow when someone comes in purportedly in labor?
Usually when a patient presents to triage and believes they are in labor, we would typically get a urine sample, weigh the patient, go over their prenatal records, question them about their pregnancy, any complications, ask them about the baby and their visits to the physician, and then from that we will do a cervical exam and usually recheck them within an hour if advanced dilation is not the case.
Why all the questions?
It is important for us to have a good idea of the care that the mother has received, any complications with mother or baby. That way we can be prepared for delivery, for adequate care for the mother and the infant.
When someone comes in for treatment at the hospital, is there any documentation that is made of the patient and the treatment provided?
Yes, we document everything we do in Watch Child.
Okay. What types of documentation do you make?
We document things like how they presented to us, when they came, what they stated about their care, what their urine drug screen showed, and what they were dilated, things like that.
All right. The Southern Ohio Medical Center maintains such records in the ordinary course of its business.
Yes.
Your Honor, may I approach?
You may.
Let the record reflect I'm handing what has been marked as State's Exhibit 1 to opposing counsel for their inspection. The record reflect I'm handing witness what has been marked as State's Exhibit 1. Ma'am, this is kind of unwieldy. This is a microphone under here, so if you can attempt not to lay this heavily down on the microphone, that'd be appreciated by the court reporter.
Okay.
If you would take a chance and take a moment and look through that. Do you recognize those documents?
Yes, I do.
What do those documents purport to be?
These are her prenatal flow sheets, records, and documentation of her labor.
Does this appear to be a medical record maintained by Southern Ohio Medical Center for Jessica Groves?
Yes, it does.
Does it appear to be a true and accurate copy of that record?
Yes, it does.
Ma'am, from time to time, unless there's an objection, if you need to refresh your recollection as to those records, you may do so. Are you part of those records in your treatment and care of Ms. Groves at that time?
Yes, I am.
Okay.
Make sure you speak up for the court reporter, okay?
I want to take you back to the Groves' initial interactions and appearance at the hospital. What were your observations of Ms. Groves at that time?
When Jessica presented to us in triage, she had come via wheelchair from the emergency department. She was very flat, disconnected, and uncooperative with our care. She kept stating, it's coming, and that is all we could get from her.
What was your first step at that point with the care of Ms. Groves?
At that point, we assumed she was most likely in labor. We started asking her questions such as how many weeks she was, if this was her first baby, who was her physician, had she had any complications with the pregnancy, and she did not answer any of our questions.
Was there anything about that that was unusual to you?
Yes, it was. We see this sometimes where they present this way in pain and cannot answer, but that was not the case here. it was more uncooperative, and just usually people will give some sort of information. That way we can at least have their name and look for medical records.
Did anybody provide you or other hospital staff with the information to those questions?
No, at one point we were given her name by her husband, and that was all.
What was her physical condition at that point?
She did not seem to us that she was in much pain for somebody that was about to have a baby, just in the wheelchair, and at that point we moved her to a bed to evaluate her.
What's the process at that point for a nurse and the staff at the hospital with regard to somebody that's in labor? What do you do after you move her to the bed?
Typically, we would have gotten a urine sample before, and we could not have done that here. So once we done a cervical exam and realized that she was complete, we moved her to the closest room to triage.
Why were you unable to get a urine sample?
For a couple reasons. She refused initially, and then after we done a cervical exam, when a patient is complete, we usually don't allow them at that point to stand. We would have put her on a bedpan once we got to the room.
Okay. What do you mean by complete?
It is in reference to a cervical exam. Closed is 0. It goes from 0 to 10, 10 being the furthest dilation. The patient is ready to deliver.
What happens at that point?
At that point, we usually call the doctor, start an IV, assess fetal well-being, keep mother on the monitor, things like that.
And were those steps taken with Ms. Groves?
Yes, they were.
Was there any point when you did get additional information as to her condition or prenatal care?
No, she would never give us any information. While pushing, when the baby was about to deliver, the father finally spoke up and said that she had used heroin 2 days ago.
All right. And that father being Daniel Groves,
Yes,
who you identified earlier?
yes.
Is there a protocol that comes into effect when you learn that someone may have been abusing drugs and being pregnant?
Yes, it was also stated that the reason that they could not get to their prenatal care visits was because she was always too high. So at that point, we alerted nursery to the possibility that there would be a sick baby, and the physician also, just for care of the mother after delivery.
What do you mean by nursery?
The nursery staff. On maternity, I would be a labor and delivery nurse, and in the back there's a nursery, and we have separate nursery staff who are trained to take care of an infant.
All right. And this is all part of the maternity department
Yes.
at the
Yeah.
hospital? Okay. So there's medical providers as well at the nursery. It's not just a place you have the baby sleep and rock, right?
Yes.
Okay. Fully equipped with medical care for the babies in the nursery?
Yes.
Now, in your daily experience with patients at Southern Ohio Medical Center, do you ever see patients that are under the influence of drugs?
Yes, I do. I worked in the emergency department for a year before I worked in maternity, so I've seen it frequently there, and then unfortunately we do see it a lot on maternity also.
And from your training experience, are there signs that indicate to you possible substance abuse?
Yes, usually how the patient presents, how cooperative the patient is, their affect, things like that. Yeah.
You've gone over some of those, and you testified that there was indications by statements that she had abused drugs. What other observations did you make of Jessica Groves with regard to potential substance abuse?
Initially, what alarmed us was that she was complete and not in pain. That's very, very unusual for somebody who we've not administered pain medication to. Very disconnected, would not respond to what we were saying. Things like that usually allow us to see that patients seem to be under the influence. She was not moaning, was not the typical patient who is delivering a baby.
All right. Let's talk about delivery for a minute. We'll go to that. Describe the typical delivery for patients in this condition.
It's usually a smooth delivery, honestly. It's usually quick and easy for them. There's not much laboring. Most of it has been done at home prior to coming to the hospital for the care. This was very typical of...
Just to make sure I'm understanding, you're talking about delivery when people who are abusing substances?
Yes.
Okay. The number of staff that SOMC staffs for such a delivery increase, or do they maintain the same?
It is the same, but if staff is available to help, we help.
Were you assisting with the delivery?
Yes, I was.
Were there any medications provided at that time for the delivery?
No, there was not. Since we were unable to initially get a urine sample from her, we will not give narcotics. And also because she was so close to delivery, it is not good for babies breathing to administer narcotics that close to delivery. So no, she was not given any medications prior to delivery.
Ma'am, you'd indicated that you could not get urine results or a urine test done earlier because of a number of reasons. Was a urine analysis ultimately done with regard to her?
Yes, it was. We asked her to void on a bedpan for us once she got to the room, and she also refused, so we had to straight cath her for a sterile specimen before any medications were given so that it would not interfere with the drug screen.
Okay. And was this before or after delivery?
This was before.
Okay. Your Honor, may I approach?
You may.
Let the record reflect, I'm handing two separate documents to counsel. They'll be marked States Exhibits 2 and 3.
No objection, Your Honor.
Ma'am, I'm handing you over the marked States Exhibits 2 and 3. Look at those and identify them for the court.
These are drug screens.
Whose drug screens are they purported to be?
Jessica Groves.
And would those be part of that larger folder binder you have in front of you as well?
Yes, they would be.
Okay. Is this the Urinalysis drug screen that you referenced earlier in your testimony?
Yes.
Okay. States Exhibit 2, and I'll put them up here for the jury to see. I'm going to have them up on the screen. We'll get you to see them from there. Okay.
Okay.
Can you see that okay over there?
Yes.
All right. What is States Exhibit 2?
She has tested positive for amphetamines.
All right. So we have being she is this for Jessica D. Groves,
Yes.
and this was registration on January 10th, 2019. Is this the morning we've been talking about?
Yes.
Okay. And we have test results here. If you could explain to the jury the layout of this form.
Over here on the left column is the the drugs we are testing for. On the side is the result. So none detected means the patient there was none detected that close to the urine, and the positive means that there was use of that.
Referring to the positive column, it looks like there's one to the right of urine amphetamine screen. Is that correct?
Yes.
And it says AB, I assume that is that unconfirmed?
Yes.
Positive. POS being positive?
Yes.
All right. And then we go through there below that, and on the other columns we see none detected. Is that right?
Yes.
Including the heroin?
Yes.
And then at the bottom we see, what do we see there at the bottom?
It is an explanation of how they run the test.
Okay. So there's an explanation how they run the test, and below that, there's what's a urine methamphetamine screen?
Yes.
And does that also say positive?
Yes, it is.
Okay. And do you understand why these are marked unconfirmed?
Yes, we do. It has recently changed. It used to just say positive, and there was a couple incidents where there was mess ups with the testing, so they decided to send this out. If there was a positive, they have this and they can retest it if need be.
All right, so if you could, make sure I understand this, the jury understands this. So they get the urine sample.
Mm-hmm.
Is that a yes? You need to say yes or no
Yes.
instead of?
Yeah.
Okay. And then they test it.
Yes.
Okay, and then they send it off to confirm that test?
Yes, they will send it down to our lab at SOMC and test the urine.
I have what's been marked as State's Exhibit 3. Can you see that?
Yes.
And what is State's Exhibit 3?
This is further testing and the amount that was found in the urine.
All right.
It
So
seems
is
to be.
this the result after they send the urine down to the lab for testing?
Yes.
Okay. So we see the same columns to the left, a little bit different writing. And then on the right side, we see the result. Is that correct?
Yes.
All right. And did State's Exhibit 3, did the lab confirm the positive results?
Yes.
Now, we had been discussing the delivery, and you indicated that have you had a number of patients that have delivered under the influence of drugs or alcohol?
Yes, we have.
All right. And have you become familiar with those deliveries by assisting in the deliveries in some way?
Yes.
All right. You indicated that the labor is usually smoother or easier.
Yes, it is.
Were there any differences between those kinds of cases of labor with those under addiction and Ms. Groves? Is there anything different about hers versus theirs?
Yes, there was. I mean, some characteristics of the delivery were typical, but even mothers who present to us under the influence of drugs will usually give us enough information when we are telling them. We told her multiple times, we just want to know so we can help your baby. We need to be prepared to take care of your baby. And she was still very uncooperative and would not give us an answer. We do this just to be ready for any of the care that the baby will need, not to punish or incriminate the mother in any way. So this was very unlike what we are used to. This delivery stood out to us very vividly for this reason. We could not get anyone to cooperate with our care, the care we wanted to provide. So yes, in that sense, it was very different.
Physically, is there still indicia of pain exhibited by the people delivering the mothers, or with the case of addicted parents, is that not as big an issue?
Usually, yes, there will still be, towards the end, I'm not sure there's much that masks the very end of labor. But in this case, no, there was not much inclination of her being in pain.
Do you recall, ma'am, how long it was from when Ms. Groves came to the hospital to birth?
Jessica presented us at 5:25 a.m. in the morning, and she delivered at 5:54 that same morning.
So roughly 30 minutes?
Yes.
Was there any complications with the delivery from the child's perspective?
No.
Did you have an opportunity to see the child after delivery?
Yes, I did. After he was delivered, they laid him on the mother's chest for a brief second and then took him to the warmer. Due to, unknown Hep C status, we usually give the babies baths immediately just to be safe, and he ended up needing oxygen, so they transferred him to the nursery.
Why is that important in these circumstances to be aware of Hep C?
When a mother has admitted to drug use, we try to be on the safe side. If a mother is Hep C positive, has admitted this to us, or has tested positive, we give the babies a bath right after delivery, so there is a minimal risk to the infant. And since we did not know in this case, but we knew drug history was a factor stated by the husband, we went ahead and gave him a bath. Nursery staff did.
All right, my approach.
You may.
Your Honor, let the record reflect on showing opposing counsel what has been marked as State's Exhibit 4.
No objection, Your Honor.
And I'm going to trace it here.
Okay.
Let the record reflect on handing the witness what has been marked as State's Exhibit 4. Ma'am, take a moment and look through that, if you would.
Okay.
Ma'am, what is that, what have I handed you as marked State's Exhibit 4?
This is the medical record of Dylan Groves.
Does this appear to be a true and accurate, complete copy of the medical records maintained by Southern Ohio Medical Center for Dylan Groves?
Yes, it does.
And are these the medical records of the Dylan Groves that Jessica Groves gave birth to on January 10th, 2019?
Yes.
You testified briefly about the delivery, that you were there. Were there any complications with the baby as a result of the delivery?
No.
Were there any physical injuries to the child?
No.
Did the baby have any complications as a result, potentially, of the mother's drug use?
Potentially, yes. When the baby was born, it was charted that he was dusky and pale, not breathing well, he was retracting. These are things we usually see after excessive drug use in an infant.
In those situations, what's the protocol that is in place for a child born?
Usually nursery staff will take the infant right to the warmer, do an assessment, and if need be, take the infant to the nursery where we can administer oxygen and do further testing and evaluation.
Were there any tests conducted on baby Dylan?
I stayed with the mother at that point, so that I'm not aware of.
Okay. From your review of the medical record, were there any tests conducted by baby Dylan? For baby Dylan?
Let me look and see. Yes, initially they would have done like APGAR scoring on him when he was first born, and then take him, after that they took him immediately to the nursery and placed him on oxygen. So any testing would have been on hold for a moment.
Okay. Ma'am, have you heard the term postpartum?
Yes, I have.
What's that referred to in the hospital setting?
In our hospital setting, postpartum is after the mother delivers. She transfers from like a laboring patient or antepartum to postpartum care. Is a mother and baby couplet.
Thank you. So what's the typical postpartum scenario for a mother and child after delivery?
Typically, after delivery, the infant is placed right on the mother's chest. We encourage skin to skin. Mothers are allowed to do this as long as they wish. After that, usually the infants are swaddled so family can pass the baby around, hold the baby. Siblings will come watch a bath, things like that.
Now, in this case, were there differences as a result of the baby's condition?
Yes, there was. Because of how Dylan acted when he was born, he was taken to the nursery and put on oxygen. And after that, Jessica or Daniel did not request to see him.
You indicated earlier that Dylan was briefly laid on Jessica. What's the purpose of that?
Usually that is typical. We lay the infant directly on the mother's chest. It's best for them to, feel the mother, be on the mother for temperature reasons. And then almost immediately after, they realized that he was not acting like a normal newborn. So then they took him to the warmer.
Did you have the opportunity to observe Jessica's demeanor at that point in time?
Yes, I did.
What was her demeanor like?
Almost the same as she presented. In the sense of a brand new baby, not interested.
At that point in time, just after delivery, did the mother have any medical complications?
No, she did not.
Did she have any, to your knowledge, later that day?
Yes, she did.
What did she have later that day?
Later in the day, she had a postpartum hemorrhage.
How many hours from birth was that, to your knowledge?
Roughly 4 hours after.
What were your duties after the delivery?
Usually after the delivery, we stay with the mothers to assess their well-being. Even if the infant stays or goes, we stay with mother to watch for things like that, make sure there's not going to be a postpartum hemorrhage, to initiate breastfeeding. Any concerns of the mother we address.
Was there any request by the mother to have Dylan brought back to her at this time?
No, there was not.
Was there any request by the mother to go to the nursery?
No, there was not.
I'd like to direct your attention to Mr. Groves throughout this process. Do you recall observations of Mr. Groves when he first came into the hospital?
Yes, I do.
What were those observations?
He seemed worried and almost afraid.
All right. Did he do any interactions with you with regard? Where was he at when you were asking Ms. Groves all these questions about her condition?
He was directly next to her in triage, and when we moved her to the labor room, whenever we were questioning her, they were both just making eye contact with each other, not acting like they were paying much attention to us until he finally gave us an answer about the drug use.
All right. And did he provide additional information after that?
The only thing that was stated to me by him was that she had used heroin and that she was always too high to go to her prenatal care visits. When they thought about going, she was too high.
Can I have her repeat that? Her voice was interrupted.
You can speak up, okay? You got a soft voice, and they need to hear you in the back of the courtroom.
Okay. The only thing that he said to us was that she had used heroin 2 days ago, and that when they would want to go to her prenatal care visit, she was always too high to go.
Where was Mr. Groves at during delivery?
Directly next to Jessica.
Okay. Did anything stand out to you about his demeanor at delivery?
Yes, just in the sense that we thought he was almost looking to her for permission to answer our questions. I could tell a couple of times he wanted to say things or answer, and he did not.
I'm not sure the jury was able to pick up all that. Could you repeat your answer?
Yes. He was looking to Jessica for permission, it seemed to us. He would look at her when we would ask questions and we thought he was going to answer what we would say, and not until we told him that it was only for baby. We only wanted to know so we could take care of their baby, was that he answered and allowed us to be clued into her drug use.
Okay. Did you have an opportunity to observe Mr. Groves after the delivery?
Yes.
What was he doing then?
After delivery, they both became almost consumed with each other. They were both just making eye contact, and neither one asked about the baby or walked over to the warmer to see the baby or followed to the nursery to go with him.
Is this typical from your observations of births?
No, it is not.
Were you ever in the nursery as part of your duties?
No, I was not.
Did you have any other interactions with Mr. or Mrs. Groves after the stuff we talked about today?
No, after her delivery and after they took Dylan to the nursery, we stayed and finished up with some of her care and finished her admission screen. And that is when she told us things like she did not have a car seat for the infant or anywhere safe for him to sleep. Those are things we screened for. And other than following up with her care like that, no, I did not have any interaction with them.
What was her affect when she was discussing the things she would need for the baby?
Almost the same. The whole general vibe, or almost her behavior that we got, was this, that she did not care.
And again, this happened January 10th, 2019?
Yes, it did.
About a year ago? Have you had hundreds of deliveries or procedures done between now and then?
Yes, we have.
I've noticed you haven't referred to the notes very much at all. Why does this stick out in your mind?
I do think it speaks volumes that all of us that cared for Jessica and Dylan remember this so vividly. The labor, the characteristics of the mother, the unattachment to a brand new baby is very out of the normal for what we see. Even mothers that present to us and are under the influence, they almost always want to hold their babies. They still want what's best for their babies, regardless of their state at that time. And I think what stuck out to us most is that there was just no concern for the infant at that time. It was seemed to be concerned for herself and her state at that time.
What about the father? I know fathers kind of just bumble around in this whole process. Is there anything unusual about his demeanor in this case?
Somewhat, yes. I think to us, we had thought that Daniel wanted to be more involved than what he was allowed to be.
Thank you, ma'am. No further questions, Your Honor.
Mr. Tinman, Mr. Kraft, are you going first?
Yes, Your Honor.
Cross-examine.
Thank you, Your Honor. Good morning, Ms. Lyles. I want to talk a little bit about your observations of Jessica.
Okay.
How did you describe it earlier?
She was very flat, disconnected, and very uncooperative with us.
Would you consider her to be belligerent?
No, I would not.
Okay. Would you consider Daniel to be belligerent during your interactions with him?
No, I would not.
Okay. When you say they were not interested in Dylan, talk about that a little more. Was that just because they didn't ask to go see him, or?
No, usually when a baby is born, there's excitement, there's laughter, people are crying, a very happy vibe in the room. The mothers are rubbing the baby and watching what they're doing. We've had mothers who are not using drugs, that their babies have to be taken to the warmer for a short period of time or for further evaluation. Usually they'll set up in the bed or ask what's going on with the baby. Fathers will step over to the warmer to be next to the baby to watch, or there's picture taking, things like that.
From your experience, did it seem to you that Jessica was a drug user or was using drugs?
It seemed to me that she was using drugs.
Okay. from your experience and her demeanor or observations?
Both her demeanor and and my observations.
Okay. When you have somebody that typically comes in that's been using drugs, what's the difference between what typically happens in the situation here, or are they the same?
Typically, when we have had patients come in complete before that are using drugs, and typically when we ask questions, who is your physician, or have you had prenatal care, even if they have not had any prenatal care, they tell us why, or they will tell us, I think I'm this far along. They give us more kind of a history of their pregnancy or what they've known of their pregnancy. And we were not given any information in this case. So not typical.
You said Daniel seemed worried and afraid of what?
He seemed worried about Jessica.
Okay.
And then when we were asking questions, it seemed to us that he wanted to answer, but was worried of the repercussion maybe if he gave us the information that she was not giving.
Okay, so he was worried about the repercussions, correct?
Yes, from her.
Okay. And he appeared to be wanting to answer your questions, but was reluctant.
Yes.
No further questions, Your Honor.
Mr. Stratton, Ms. Scott, you may cross examine.
Good morning, Ms. Dines. Good morning.
I believe that Mr. Stratton covered some of the material that I wanted to cover with you as well. Your basic description of Jessica Gross was that she was uncooperative during this whole entire time, correct?
Yes.
You also mentioned that Daniel Gross did finally at some point in time fess up or confess and stated that he believed that his wife had consumed heroin at least 2 days prior to the birth.
Yes.
Although she didn't test positive for that, that's what he believed.
Yes.
And stated to you. Okay. Then you also described additional, even after the birth, that she remained uncooperative, even when asked, hey, we just need to help your baby, we need to know what's going on. So this pattern of uncooperativeness seemed to continue, is that correct?
Yes, it did.
And then you also described some behavior on behalf of Daniel that appeared as if he was worried and almost afraid, correct?
Yes.
Okay. And then you also described behavior that almost looked like he was looking for permission to be able to answer these questions from Jessica Gross. Is that correct?
Yes, it is.
Okay. So he appeared to be wanting to be cooperative, correct?
Correct.
And there was some kind of connection, some kind of threat, or some kind of perceived problem that would be caused if he was cooperative with you. Is that correct?
Yes, that's what we got. We didn't see Jessica do or say anything to him to tell him to stop. That is just sort of the
Vibe you got?
Yes.
Okay. That's what you picked up from him?
Yes.
Okay. And you felt, I believe that your words were that you felt that Daniel wanted to be more involved in this process, but I wasn't for sure what word you exactly used, but almost as if Jessica's presence there and her control over him was almost intimidating him.
Yes.
and not answering the question, correct?
Correct.
And almost as if he would suffer some repercussions if he was honest and forthright, correct?
Correct.
Do you know, or did you have any discussions with him when he actually learned that Jessica was actually pregnant and carrying their child?
No, I did not.
Okay. I know that you mentioned that he mentioned not attending prenatal appointments because she would be too intoxicated.
Yes.
But you do not know when he actually learned that she was pregnant with her child, correct?
No, I do not.
Okay. Thank you. I think that's all I have this time.
Ms. Scott, Mr. Teeman, any redirect?
No redirect, Your Honor. Thank you, Ms. Lyles.
Is this witness excused?
She is.
Defense excused her also.
Yes, Your Honor. Thank you.
And you're free to go. Yes, you go into the bailiff.
Okay.
Mr. Teeman, you may call your next witness.
Norman State will call Tori Howe.
Sorry, Ms. Hutchinson. Ma'am, will you raise your right hand for me, please? Do you solemnly swear the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God? Ma'am, please have a seat. Ma'am, we do have media in the courtroom here today. Do you have any objection to your image being filmed or photographed during your testimony? All right. Now, you speak quietly. You're going to need to speak up real loud for the court reporter. Okay? Ms. Hutchinson, you may inquire.
Thank you, Your Honor. If you would introduce yourself to the jury and spell your last name for our record.
Hi, my name is Tori Howell, Howell.
Ms. Howe, how are you employed?
I'm sorry.
How are you employed?
I'm employed by Southern Ohio Medical Center.
Okay. And what is your job title there?
I am currently a labor and delivery nurse. I switched from the nursery, but at this time I was a nursery nurse.
Okay. And how long have you been employed with Southern Ohio Medical Center?
Since June of 2017.
Okay. And if you would tell the members of the jury what some of your job duties were last year in January of 2019 as a nursery nurse.
So as a nursery nurse, we would go to the deliveries. We would take care of the baby at delivery. The baby needed extra help breathing. We would, try to resuscitate it. We would do the baths. We would do Finnigan assessments.
Let me interrupt you just for a second.
Yes.
What is the Finnigan assessment?
It's a Finnigan, it's a neonatal abstinence syndrome assessment that's done every 4 hours on every baby who has drug abuse, in its system or a history of it with the mom. And we do this every 4 hours to assess the baby, see how it's doing on its withdrawal symptoms.
Okay. What are some of the other things that you do as a nursery nurse with babies? Assessments or evaluations?
We sign the babies on 3 times a day. We do the baths. Just different things. We have babies on Optiflow oxygen sometimes.
Okay. Are there evaluations or assessments that you do sometimes to determine the gestational age of the baby?
Yes.
Okay, explain that to the jury.
That's a Ballard assessment. So whenever the baby is born, every baby gets this done. We do a Ballard assessment. So depending on how the baby looks, just different features, if their wrist bends, how their wrist bends, if it bends far back or not enough, we can determine about how far along the baby was gestationally.
Okay. So how long the mom was pregnant? in
Yes.
other words? Okay. What other types of assessments do you all do there as part of the nursery?
We do vital assessments, the Finnigans.
Okay. Let me direct your attention to January 2019. Were you working on the evening of January 9th and the morning of January 10th?
Yes.
Okay. Did you have an opportunity to assist in the medical treatment of a patient named Jessica Groves and her newborn Dylan Groves?
Yes.
Okay. Do you have an independent recollection of that? Do you remember this incident?
Yes.
Okay. Explain to the members of the jury how you became involved in this treatment.
So around 5:45 that morning, our charge nurse from labor and delivery called back to the nursery. The nursery is like a separate unit, kind of. We're all maternity, but labor and delivery is out front and nursery is separate in the back. We have a room that's enclosed. It's a locked unit.
Let me interrupt you just for a second. You have a locked unit back there. Explain that to the jury and what's the purpose of that?
So the nursery is a locked unit. It's just so that people can't get in or out with babies, that our babies are protected in the nursery, because people bring their babies over to sleep and to do different assessments and things like that. So.
Okay, so delivery takes place, you said, out front?
Yes, delivery takes place in the labor and delivery rooms.
And then the babies, if they're separated from the mothers, would be taken to a locked unit in the nursery in the back?
Yes.
Okay. And I think I'd ask you how you became involved with this particular patient, but before we get there, let me back up just a minute. Are there, I guess this is not really a good term, but kits that you guys use when you get a call saying we have a mom getting ready to deliver a baby?
Yes, so we have little buckets that just kind of have like hats, blankets, diapers, things like that to get so that we're ready for delivery in any amount of time. we're always ready.
Okay, so once you get that call from out front, you grab your little buckets and
Yeah.
pre-made buckets and go to the front.
Yes.
Okay. Explain to the members of the jury what typically happens once you arrive there, what your job is out there in maternity or delivery.
So once we get to the room for a delivery, we set up and make sure that our warmer's ready so that we have all of our items ready for resuscitation if we need it. I like to just make sure that all my stuff's ready, get my blankets set up, make sure they're warm underneath the warmer. There's a radiant warmer to stick the baby underneath
What's the purpose of that radiant warmer?
to keep the baby warm.
Okay, keep his body temperature up? All right. And so you were explaining to the members of the jury the call you got in regards to the treatment of Jessica Groves. Go ahead there.
So we got the call about 5:40. We grabbed our bucket, Courtney and I, and we went to the delivery. Whenever we got there, she was being transferred from the triage bed to the regular labor and delivery bed. And we just continued to set up our supplies.
Okay. Before you arrived there, were you provided any information regarding this patient from the nurse that called you?
She literally said, "Hey, it's Jessica. We have a patient going to room 1. She's complete. Come on." And I said, "Okay."
When you say complete, what does that mean?
She's ready to deliver. She's dilated 10 centimeters and 100% effaced.
Okay. When you got there, who did you see?
I saw Jessica Groves and her husband.
Okay.
I saw Jessica Shaw, Darian Lyles, Megan Sadler, Amanda Jones.
Okay. These other people are those nurses?
Yes.
Okay.
Yes.
And what's everybody doing in there? Describe what that atmosphere is as you enter the room there.
It's tense. Everybody is kind of trying to get things ready. You know, there's certain things that you have to do before delivery to get the room ready, to get the patient ready. So everybody's just trying to get everything ready before the doctor gets there. And
If you would describe to the members of the jury the defendant Jessica Groves' demeanor as you come in.
whenever I came into the room, she was just laying in where she was being transferred to the bed, but she was like moaning. I didn't hear her say any words, but she was just like moaning in the bed. Like she was annoyed that she was there. She just acted like she didn't want to be there, anywhere but there.
Okay. You said you've been at Southern Ohio Medical Center since 2017? Okay. And that you're a registered nurse. You've been in maternity and in the nursery. Have you had an opportunity throughout that time to observe mothers who are under the influence as they come in to deliver their babies?
Yes.
Did you see or make any of those observations as it relates to Jessica Groves?
Yes.
Okay. Explain that to the jury.
She just appeared high whenever she was in the bed, just moaning, like she wasn't in pain, but she was just annoyed that she was there.
Okay. Were there any pain meds given to defendant Jessica Groves as far as you know?
Not that I'm aware of.
Okay. Explain to the members of the jury the delivery. Were you there when that baby was delivered?
Yes.
Okay. How quickly did that occur?
Well, I'm not exactly sure on the time, but I remember waiting at the warmer for Dr. Adams to get there because it took him, he was at home, so he had to be called in. So it took a few minutes for him to come in.
Okay. But would you consider this a quick delivery from the time you arrived to the time that this baby was born?
Yes.
Okay. And what is it that you do with baby Dylan once he's born?
Once he's born, because she came in the way she was acting, we didn't know her Hep C status. So either way, whether the baby had respiratory distress or not, I was going to bring the baby over to the warmer no matter what. So as soon as the baby was born, the cord was cut, we brought the baby over to the warmer to make further assessments and give the baby a quick bath before we would do anything else with it. We did not give it a bath at that point. The baby was having some respiratory distress issues, so we ended up evaluating the baby there and assessing the baby and taking it over to the nursery.
Okay. When you say respiratory distress, you mean the baby was having trouble breathing?
Yes.
Okay. And so you removed the baby from the room and took him to the nursery. Did either parent go to the nursery with this baby? Did either parent ask about the condition of this baby as you removed him from the room? Okay. What do you do with baby Dylan once you get him back to the nursery?
Once we got him back to the nursery, I believe we set him up on Optiflow. Sometimes it just helps, it's kind of pressure, like oxygen, and it just goes through nasal prongs through their nose, and it just helps the baby's lungs expand and helps them get to have a regular breathing system.
Okay. At some point, do you, using the evaluations we spoke of earlier, determine what his gestational age was? Okay, explain to the jury how you did that and what you found in doing so.
So there are just different assessment tools that we use, like I said, just like how their wrist bends, different things like that. And we determined that the baby's gestational age was 36 weeks.
Okay, and full gestational age is what?
40 weeks.
40 weeks, okay, so he was approximately a month early? Okay. Would that contribute to his breathing difficulty?
Yes, that's typical for a 36-weeker to have respiratory distress issues at delivery.
Okay. And explain to the members of the jury, in your work there at Southern Ohio Medical Center in the nursery and as a maternity nurse, have you seen babies who are exposed to drugs?
Yes, absolutely.
How often would you say you see that?
I would say just about every day.
Just about every day. Okay. Explain to the members of the jury what symptoms or signs babies who are exposed to drugs exhibit.
Just different things. Tremors, either disturbed or undisturbed, meaning if you would disturb the baby would have tremors, or even just laying there, the baby would have tremors. Sneezing, temperatures, sweating, loose stools. They can have diarrhea, even with the meconium that babies usually have right after they're born. Just different things like that.
Okay. And throughout baby Dylan's stay there at the hospital, was he observed to have symptoms of drug withdrawal?
Yes, I believe so.
Okay. You would have had a shift change sometime that morning, is that right? Mm-hmm. About what time was that?
Around 7 o'clock, the day shift comes on.
Okay. 7 a.m. you said?
7 a.m., yeah.
Okay. And the birth was shortly before 6 a.m.?
Yes.
Okay. During that time frame, do either parent appear at the nursery asking about the condition of the baby or asking to see the baby?
No.
Okay. When you left the room with baby Dylan, was mom okay? Stable?
As far as I knew, yes. Yeah, I wasn't really paying attention just because I was worried about the baby, but yes.
Okay. Let me take a little, just sidetrack you a little bit about a procedural issue. As part of the regular, everyday interactions there at Southern Ohio Medical Center, do you all maintain records for each patient that comes in?
Yes.
Okay. And those are kept every day in the normal course of business for each patient that you see?
Yes.
Okay. Let me hand you what's previously been marked as State's Exhibit 4 for identification.
Okay.
Do you recognize the documents that I just handed you?
Yes.
Okay. What are those?
These are Dylan Grove's medical records.
Okay. And how do you know that those records belong to Dylan Groves?
Because they have his name, his date of birth, his medical record number, his visit number, all that kind of stuff. All that patient identifiers that we use to identify a patient.
Okay. And if you wouldn't mind to just flip through those and then tell the jury whether or not you believe those to be a true and accurate representation of the care that was given there for Dylan Groves while he was there at the hospital.
I've looked through the chart many times.
I'm sorry?
I've looked through it many times.
Okay. Through this particular chart?
Yes.
Okay. I'm going to hand you what's going to be marked as State's Exhibit 5 for identification. me hand you what's been marked as State's Exhibit 5 and ask you if you recognize that record individually.
Yes.
Okay, what is that?
This is Dylan Grove's urine drug screen profile.
Okay, and is that a part of something that was taken from this whole record, complete
Yes.
record?
Yes.
Okay, I might put that up on the screen for the jury to see. Okay, and I think you said earlier, you can identify these records, the patient's name, the patient's date of birth, and then they also have a medical record number associated with each patient, is that correct?
Yes.
Okay. And so if you would explain to the members of the jury what this is and what it indicates.
So the baby was positive, had an unconfirmed positive for amphetamines.
Okay. And if there's an unconfirmed positive test for amphetamines or any other drug, what happens then?
So then we do our Finnigan assessments on the baby if the baby has a positive drug screen. Because there was no prenatal care in this case, she was not able to have drug screens during her pregnancy, so we always get a urine on baby if there's no prenatal care visits. So
Okay.
once we got the urine drug screen and it was positive, we started doing our Finnigan assessments every 4 hours and started evaluating the baby for withdrawal symptoms.
Okay. And is there a process that the hospital uses to confirm those pre-screens, so to speak? Do they send it on for a confirmation screening?
Yes, I believe they do, yeah.
Okay. Let me hand you what's been marked as State's Exhibit 6. And ask you if you recognize these documents.
Yes.
Okay. And how do you recognize them?
This is the baby's cord drug panel that we sent off.
Okay. Let me put this up on the screen.
Should this defense counsel discussion?
Oh, I'm sorry, Your Honor. And so State's Exhibit 6 also identifies the patient by name, which is baby Dylan Groves, the date of birth, and then looks like several substances that would go to the lab and be further tested, is that right? Okay, and if you would, look down through there and explain to the jury which ones show a positive screen.
So, looks like the positives were amphetamines, methamphetamines, fentanyl, opiates, morphine, and I think that's it. I can't really read it very well.
It's farther away from you, isn't it?
Yeah.
All right. And if I might hand you lastly State's Exhibit 7 for identification record that I'm showing defense counsel. You would explain to the members of the jury what the hospital does with the baby's umbilical cord at that point.
So, at every delivery, we get a cord sample. So the doctor will cut us off a piece of the cord, and we only send that if there's drug use suspected or if we get a positive. So at this point, we put it in a box, we seal it up, and we send it off to get the drug screen results from the cord.
An outside lab also looks at it?
Yes.
Okay. And then is the hospital notified as the result?
Yes.
And does that then become a part of the patient's record?
Yes.
Okay. If I hand you State's Exhibit 7, ask you if you recognize that.
Yes.
Okay. And what is that?
This is the piece of paper that comes across the printer in the nursery every time that a drug screen or cord screen comes back.
Okay. So for State's Exhibit 7, the nursery would receive notification from an outside lab about the results of the cord, is that right?
Yes.
Okay. And I don't know, can you see that?
A little bit.
Let me see if I can zoom in there.
Yeah, I can see that better.
You would explain to the members of the jury what's revealed in the cord test.
The baby was positive for amphetamines, methamphetamines, fentanyl, opiates, and morphine.
There, looks like there are subsections under opiates that show positive, morphine and hydromorphine.
Okay, yes.
Let me hand that back to you so you can
Sorry.
see that it close, that's okay.
Yes. Positive for the morphine.
Okay. What type of treatment does SOMC provide to babies who are subjected to substances like this?
So with the Finnigan assessments, we do them every 4 hours. And if a baby at that time got over an 8 score 3 times in a row, we would start the baby on our morphine withdrawal protocol.
Okay. To your knowledge, was baby Dylan bottle fed or breastfed?
Bottle fed.
Okay. To your knowledge, was there any request from the mother to have her baby back in her room or hold the baby?
Not to my knowledge.
Okay. I think that's all I have at this time, Your Honor.
Ms. Hutchinson, Mr. Stratton, you may cross-examine the witness.
Good morning, Mrs. Howe. How are you?
Good, how are you?
Good. You mentioned earlier about the signs of exposure for a baby who's been exposed to drugs. You mentioned tremors, sneezing. Probably going to have to say yes.
Yes, sorry, yes.
The recording. So, and other signs like that. But what signs did Dylan exhibit?
So after delivery, normally the symptoms don't show up.
Okay.
Until 24, 48, 72 hours after delivery.
Okay.
So I don't believe that I exhibited any of those symptoms that he had.
Okay. You also talked a little bit about Jessica's demeanor. You said she was moaning. Any idea why?
I thought she was just annoyed that we were asking her questions.
Okay. It wasn't moaning in pain?
No, I don't think so.
Okay. Why didn't you think it was moaning in pain?
She just didn't act like a normal labor patient. She didn't act
Okay.
like she was in a whole lot of pain.
Okay. Okay. You also said she acted like she didn't want to be there, correct? Yes.
Yes.
Okay. And that she appeared high?
Yes.
Yes. Okay. Well, tell me a little bit more about that. How did she act like she didn't want to be there? What did she do?
So typically whenever we have a patient who comes in and they appear to be high, typically that patient will let us know the drugs that they've taken, when they took them, because they want us to take care of their baby the best way that we know how.
Okay.
They want us to be fully prepared, and she did not do this.
She didn't ask you anything, didn't tell you anything?
Not that I'm aware of.
Okay. No further questions, Your Honor.
Thank you, Mr. Stratton. Ms. Scott, you may cross-examine the witness.
Thank you, Your Honor. Good morning, Ms. Powell. Hi. Okay.
When you stated that you described a lot of the behavior in regards to Jessica Groves. Did you have much interaction with Daniel Groves on that day?
Not much, no.
Okay. Did he attempt to answer any questions for you all when you as part of the staff or whatever was asking in regards to drug usage on behalf of the mom? Did he attempt to answer any of the
I
questions
think that
for
he
you?
did end up answering a couple questions for them, but I didn't get those answered relayed until I was already back in the nursery, just because
Okay.
everything happened so quickly.
Okay, got you. You stated that the birth was shortly before 6 a.m., is that correct?
Yes.
And your shift ended at 7 a.m., is that
Yes.
correct? Okay. Were you on shift the next day?
I don't know.
Okay. So do you have any independent memory of how much time you actually interacted with these parents? Other than that almost hour to and a half of time on this particular day, the day of Dylan's birth?
I don't know exactly a time frame, how many days I was there while the baby was in the nursery. But I do remember, in the nursery, we don't really have assignments. We kind of just jump around and do things as they need to be done.
Sure.
And so I do remember being in there whenever they were in there later on.
So on a later shift, on a different day, the parents were in the nursery with the baby?
I just remember the dad being there, not the
The
mom.
dad was in there for the baby? Okay. And the baby was there for several days, is that correct?
Yeah, I believe so.
Okay, but you do recall the dad being in the nursery with the baby on one of your later shift on a later day, is that correct?
Yes.
Okay, thank you.
Thank you, Ms. Scott. Any redirect, Ms. Hutchins?
Just a few. You said earlier you took this baby out of the room because he wasn't breathing well.
Yes.
Did Daniel Groves follow you down the hall and ask about his baby?
No.
Over the next hour, did Daniel Groves appear and ask about that baby?
No.
Where was he when
He
you
was
left?
at the bedside with Jessica.
No further questions.
Mr. Stratton, any recross?
No, Your Honor.
Scott, any recross?
Yes, thank you, Your Honor.
Did Daniel seem concerned about his wife and his wife's health condition right after delivering the baby?
I honestly don't know. I wasn't paying much attention. I was more concerned with the baby and its health.
And if there was something going on with the mother and her medical condition, would it be atypical for the spouse to stay there with the other spouse and the baby being taken care of by medical staff? Would that be atypical?
It's really just personal preference. People do it different ways all the time.
So it's a split decision. It's kind of like, do you go with the baby or do you stay with your spouse? And it is a personal decision. So it's not atypical for that period of time that he would have remained with his wife versus going with the baby, correct?
I guess, yes.
The medical staff had the baby, correct? Well, in good hands, correct?
Yes.
Okay. And he may have just chosen to stay with his wife to see what kind of medical concerns she had going on.
That could be possible, yes.
Okay, thank you.
Thank you, Ms. Scott. Any other questions for this witness?
No, Your Honor.
Is this witness excused by the state,
Yes, Your Honor.
by the defense?
Yes, Your Honor.
Ms. Scott, is she excused?
Excuse, thank you, Your Honor.
And you're free to go. Thank you very much. Council approach. We are going to get a couple more witnesses on before our lunch break. That now might be a good time to take a short recess. I am going to remind you of my earlier admonition to you. Do not discuss this case amongst yourselves. Do not permit anyone to discuss it with you or in your presence. It is your duty not to form or express an opinion on this case until the full case is finally submitted to you. This time we will take a recess. I will tell you that as soon as the jury is ready to come back to the courtroom, me and the lawyers will be ready to start back. This time, court is recessed.